Ayo is easy, and to sign up is just as easy. Meet Abel Mutula from the barbershop in Kalingalinga. Abel Mutula is also an Ayo customer.
My name is Abel Mutula. Signing up with Ayo was easy. This is how I signed up. Step 1, dial *296#. Step 2, select one, sign up. Step 3, select either 1 for my hospital or 2 for my life. Step 4, fill in your age and confirm. Step 5, select 1 to accept the Ayo terms and conditions. Well done, you signed up. Now let's add my loved one.
Ayo together with MTN. Ayo, because you care.
Hello and welcome to this discussion for today. So today we are looking at diarrheal diseases. As some of you may have noticed that we are experiencing a high number or a higher frequency of diarrhea in our communities, both in adults and in children. So we are very grateful to our sponsors, MTN, for making this conversation possible, for bringing us together in this manner to discuss this very, very important topic. And we expect that you will participate, you will ask questions, you will make this very interactive. So go ahead and tell us where you're watching us from. We would like to know, as usual, where you're watching us from. We are interested to see where you're watching us from. And while you're at it, go ahead and either tag somebody, share the link, invite someone. We need to have as many people as we can on this platform today to sort out this very important conversation. So go ahead and invite someone. We hope you had a productive day and that you had a productive weekend as you prepare for work tomorrow. So today we are looking at diarrhea. Now, we will navigate this subject both in children, particularly, and also in adults. What things should you be looking for when someone has diarrhea? What things, even you as an adult, what things should be, on your mind or top of the agenda when you are concerned about relating to issues of diarrhea? Now, first of all, first things first, when we talk about someone having diarrhea, we are basically saying this is someone who's had 2 or more loose stools in a day, or 1 large loose stool. That's when we consider you to have diarrhea. Now, different types of diarrhea present differently. You have diarrheas that are associated with vomiting. So someone would have diarrhea and vomiting, very common in children. You would have diarrhea, there's no nausea, there's no vomiting, it's just diarrhea. You also have diarrheas that are associated with blood in stool. You also have diarrheas that are associated with abdominal pain. And also you have diarrheas that come with other non-abdominal symptoms. So someone has a diarrhea quite all right as a feature, but they have non-abdominal symptoms, like they have symptoms from another system, but they also have diarrhea. So those are things you need to look at. So then, to start with, when someone has had a loose motion or someone has passed loose stool, if it's just one motion and it's not a very large motion and it stops, that can happen. Sometimes, for example, if you have suffered food poisoning. Now, when we say someone has suffered food poisoning, we are not saying that a person or your enemies went and picked a poison and put it in your food and you ate it by accident. Food poisoning basically we refer to the fact that you ate food that was contaminated with bacteria, food that has been infected. And usually this happens in parties, especially in this hot weather. As you are attending Ichilanga Mlilo, as you are attending weddings, as you are attending kitchen parties, birthday parties, sometimes pay attention to what you're eating. Is it fresh food? Again, you see, in these social gatherings, it's very difficult to also look at food handling because, I mean, you trust. So sometimes it can happen that straight from a party, you ate something and your tummy is upset and the food was, was infected or contaminated with bacteria. And that's what we refer to as food poisoning. You ate food that was, gave you the infection and you end up with diarrhea. Usually this type of diarrhea may give you abdominal discomfort, not necessarily pain, abdominal discomfort. It's self-limiting in the sense that the diarrhea itself is actually both a disease and a solution. So the diarrhea is your body's way of trying to get rid of the contaminant that has contaminated your intestines. So diarrhea is sort of like you can say it's a survival mechanism that through evolution your body has adopted to get rid of the issues. So now let's get into this subject matter. So when someone has diarrhea, there are different types of causes. So the way we are going to discuss this is that we will separate the diarrheas that have blood in stool and diarrheas that do not have blood in stool. So during this season, a food poisoning, which is very common, generally does not present with blood in stool. So the first cause of diarrhea you will experience, or even your children will experience, is food poisoning. So they went to a party or even in the house or somewhere. Usually food poisoning happens at parties anyway because of different food handlers. So you find that the food is infected, you eat, you end up with diarrhea. This type of diarrhea generally is self-limiting. You may have, loose motions for a day. By the second day, you're feeling better and you'll be fine. Usually what you're advised to do is to take a lot of fluids when you're having diarrhea, especially in this weather. Because it is so hot, okay, it's very easy for you to become dehydrated, even if you are an adult. Why? Because you are losing a lot of fluids through diarrhea. And so when you're having diarrhea, whether it's food poisoning or not, even before you go and see a doctor at home, drink a lot of fluids. And also what you could do is that you could also, use your own ORS if you have oral rehydration salt at home, make the drink. You can also use your own ordinary salt and sugar to make it for yourself. Drink that as you wait to go to the hospital. The other very important type of diarrhea, as we even go into the rainy season, is because, you will find that this particular diarrhea is waterborne. Waterborne in the sense that, and it's also transmitted through oral fecal, meaning that you must have consumed someone's fecal matter for you to have had this particular diarrheal infection. And this is cholera. Now, as we go into the rainy season, and particularly in this weather, the rainy season is about to approach, cholera will become a very important conversation. Of course, some of you may have had the vaccine. Remember, there was a vaccine for cholera at one point. So that's why you've not been seeing a lot of bouts of cholera because of that vaccine. But cholera is a bit special in the diarrheas that don't present with blood in stool, in the sense that you actually pass water, instead of actual stew. You may have stew in the beginning, but as the disease progresses, what actually comes out once you have the cholera infection is water. In fact, it's got a specific description. The diarrhea is watery, and it's described as rice water type of diarrhea. So when you see that type of diarrhea from somebody, now cholera is a bit special. It's a notifiable disease. So if you suspect that yourself or your loved one or your neighbor or someone who lives in your house has diarrhea that looks like cholera, that diarrhea needs to be reported to authorities. And usually the diarrhea is frequent and it's watery, like really literally like water. And typically speaking, the stew looks like rice water. Now, rice water, you remember like when you clean rice, that water, the sediment that remains after you've cleaned the rice, that's how the cholera looks like. So when you suspect that somebody could have that, this is a notifiable disease. You need to isolate the person, you need to notify authorities, and don't even hesitate. Call the authorities. They need to know that this is what you're having, and the authorities will pick it up from there. They will come and take your patient, and they will also do the necessary fumigation that needs to be done and things like that. Now, the challenge you have with cholera is that it thrives in communities where you don't have access to clean water, especially drinking water. And also in communities where you have boreholes that are sunk next to soakaways. So you need to be very careful. If you have a lot of boreholes in your community and you also have a lot of soakaways, you don't have like a centralized sewer system, then, chances of contamination are actually there, especially these waterborne diseases. Chances of contamination are actually there. So just bear that in mind. So as we go into the rainy season, so let's bear in mind we are about to get into the rainy season, and this is probably the best time for people to start putting together, preventive mechanisms for cholera in your communities, sensitization, hand washing. Okay, look, we've had COVID. Under COVID, we've been doing a lot of hand washing, sanitization, and social distancing, avoiding social contact. That also will help us as we go into this season where we might end up with cholera. So, that said, it's very important that as we go into the season where cholera is usually common, it's important that we remember to improve our access to clean water, continue with our hand washing. Now you even have sanitizers, even better. So let's bear that in mind. But should you notice it, please inform authorities because it's important. Okay. Now, with diarrheal diseases in children, and the diarrheal diseases in children may also involve some viral infections. There's some viral infections that may start with nausea and vomiting in a child. After a bout of nausea and vomiting, after a day or two, the child also starts having diarrhea. Now, with children particularly, you need to be very careful, especially with these viruses that can cause diarrhea in children. You need to be very careful. Be very, very, very careful. It's because children, things change too quickly when a child has diarrhea. I'm sure some mothers have experienced this. Things change very fast. So, to you mothers, when you notice that your child is having diarrhea, you've changed the diaper once, twice, 3 times a day, 4 times a day, you know that this is a serious problem. First of all, if your child is still breastfeeding, it's important that you continue breastfeeding the child. But one of the things you should not even hesitate, if you've seen that your child has had 3 or more bouts of loose stool, don't sit at home. Why am I saying this? In children, diarrhea is very, very dramatic, especially if it is also associated with vomiting. It's extremely, extremely dramatic. Dramatic in the sense that they change condition very quickly and very fast. If you delay to seek help, children die. So don't take diarrhea and vomiting in children lightly. Especially, we hear mothers who say things like, no, my child is teething. So because my child is teething, I was told that if the child is teething, they usually have diarrhea, so it's normal. It is not normal. Okay? It's not normal. Yes, your child may be teething. And usually when children are teething, you find that they like putting things in their mouth because of the irritation of the gums. It's very easy for them to put anything in the mouth that can actually, cause an infection. So if your child is teething fine, diarrhea is not normal. So do not ignore it by saying, no, because your child is teething, therefore this diarrhea is fine. It is not fine. Especially if you are changing diapers in your child 3 or more than 3 times in a day, then you know that you're in trouble. Or you've seen that your child is passing, loose motions more than 3 times a day, you know that you're in trouble. So do not wait at home. And this is the mistake that we've seen a lot of mothers make, where they are waiting and waiting and waiting. By the time they are taking the child to the hospital, the child is severely dehydrated, almost at the point of death. Don't do that. You don't need to wait. Do not wait or even hesitate or waste time if your child has had these loose motions. The other type of diarrhea you need to bear in mind is the diarrheas that come with blood in stool. The commonest we talk about, that you hear about, is dysentery. So dysentery will present with diarrhea, but the diarrhea will be bloody, and they will also may have fever. Fever meaning that body hotness. It may even be present. So dysentery is a very serious illness. It can even cause death. But the beauty about it is that it responds very well to treatment. And if you see that even yourself, you're having diarrhea and you're also having blood in stool, it's important that that is sorted. But the other important type of diarrhea that also presents with severe abdominal pain, this one presents with abdominal pain. It also presents with body hotness, fever. It presents with blood in stool. It's called typhoid. Now, typhoid may have other signs as well. Now, typhoid, the reason you need to be very careful with typhoid is because with typhoid, it's sometimes very difficult to distinguish it from dysentery. So a patient who has typhoid and a patient who has dysentery, it's sometimes very difficult to tell them apart unless you go to the hospital. But of the two, yes, of course, dysentery is very dangerous and it's very contagious and it spreads very quickly. I can even also cause death. Typhoid is even worse because with typhoid, there are people who may not even have diarrhea or symptoms, but they are carriers of the typhoid. So they carry the typhoid in them, and because they handle food, that is why your local authority does inspections on food handlers and the test food handlers, because some people can actually carry typhoid with them. And they are shedding typhoid. Every time they go to the toilet to pass to and they clean themselves, they are shedding typhoid, and they come and handle food, and you come and eat the food, and that's how they spread the typhoid. Now, typhoid, unfortunately, if it is not identified early and in good time and treated aggressively, it can result in very serious complications. One of the complications you will have with typhoid is that it can cause perforations in the intestines. Okay? Typhoid can cause perforation, where your intestines become perforated. And when your intestines become perforated, you may end up with what we call a frozen abdomen, where your intestines don't move at all. They are frozen. You may end up with what we call intestinal obstruction, where food is not passing, going through your abdomen. The worst thing you can also have is that you can have leakage of intestinal organs, intestinal content into your abdomen. And when you have such a leakage, intestines now become perforated, and those perforations are extremely difficult to treat. Very difficult to treat. You may end up with repeated surgeries, and no matter how much they do the surgeries, sometimes, if you're unlucky, usually you find that when typhoid reaches that stage, it's extremely difficult to treat, and that is why we must prevent typhoid at all times. Now, in Lusaka, right now as we speak, there's a spike, or there's a slight increase, or there's a noticeable increase in the number of people who are presenting to hospital with typhoid-like symptoms. So as you go to these restaurants, in fact, that is why the council is very keen on making sure that food handlers in your favorite restaurant are tested and they are screened. It's very important. And other places where you can get typhoid, it's in these parties that you go to, in these braais, where you go and you're having a party, having a good time. Some of the food handlers may also have these problems where they themselves, they are not having the symptoms. They are not experiencing diarrhea or abdominal pain, but they are carrying the typhoid and they're spreading it. So just be very careful. So should you suspect that you may have typhoid, and how you would suspect is if you have abdominal pain and you're passing diarrhea, and the diarrhea also has blood in it, then just know that you could have typhoid, in as much as dysentery could also be a possibility. So that's how you think through these things, and that's how you process the information. So when you hear that your relative has diarrhea, ask yourself the following questions. Is there body hotness? Okay, so if there's no body hotness, it's probably that the diarrhea is not caused by an infection per se. Okay, it may not be caused by an infection per se, although there are some infections that can cause diarrhea without necessarily causing body hotness. The second thing is that, how many times has the person passed loose stool in a day? If it is more than 3 times in a day, take that person to the hospital. If it is yourself, go to the hospital. If it is your child, take the baby to the hospital. If they have passed more than 3 loose motions in a day, take them to the hospital. Is there blood in stool? Okay. If there's blood in stool plus diarrhea, it doesn't matter how many times they have passed loose motion. Take them to the hospital. Even if they've just passed 1 bout of loose stool, if there's blood, do not wait until they've passed 3 motions. In that scenario, take them to the hospital immediately. Why? Because there's blood in stool. They also have abdominal pain. Take them to the hospital. Okay. If it's a child, don't hesitate. All right. That said, let's see if you have questions for us. Sorry, can you hear us? Please tell us if you can hear us. We were experiencing a minor technical challenge. Let us know if you can hear us, please. We were experiencing a minor technical challenge. Kindly let us know if you can hear us. Okay, great. So we are heard. Now let's go through your questions. So this is not a question. This is Maria Lubilo Chimana Chanda. Thank you for the information, Doc. May God bless you. Thanks for the encouragement. Thank you, Doc. This is very helpful. Okay, great. This is Josephine Mwansa. Thank you. Questions? Okay, yeah, there's a question here. Doc, can typhoid cause issues with acid reflux? No, not really. It's not associated with things like that, generally speaking. So typhoid is not really associated with acid reflux. With acid reflux, the infection that is associated with acid reflux is Helicobacter pylori. And the infection sits in the stomach, and that is what is associated with acid reflux. So not really. Next question is Tiwonge Zekezeke Kasonde. Question is, Doc, how about diarrhea that's triggered by the change in environment? What causes that? Now, you must understand that not all types of diarrhea come because of an infection. Sometimes anxiety itself, hormones. If you are anxious and you have anxiety, that itself can also potentiate diarrhea. Haven't you noticed that sometimes when you are really, really scared, or sometimes when you are really, really anxious, or sometimes when your girlfriend has dumped you and you're not expecting it, it can induce diarrhea. Now, that type of diarrhea is self-limiting, okay? You will have diarrhea because you are really scared, because you are really anxious, or you are really shocked, and you have these stress hormones that have overwhelmed your body. It's very easy for you to have loose motions. So even a change in environment can also do that to you. So to answer your question, yes, a change in environment can induce that, but that's purely because of emotion, a change in your hormones. Sarah Ngoma Misale, doctor, but how can one make ORS at home? I mean, how many spoons and sugars and salt? Okay, good. So this one is a good question. What I'm going to do for you is that we will post on the page WHO standards on how you make this. So we'll get an extract from the WHO. Keep watching the page. We'll put it on the page for you, so that it's very important, and this is an important question. It's very important that you learn how to make your own ORS from home as well, because it helps. As you are taking the patient to the hospital, you are giving the patient the ORS as you are going, the oral rehydration salt. So for you, we will do that for you. We'll put the WHO standard on the page before day ends. Next question. This is Kampamba Ngoshe. What could be the first line of treatment for these conditions apart from rehydration? Now, understand this, that first line of treatment, if it's at home, if you are at home, as you are taking the patient to the hospital, and they are conscious enough to be able to drink and swallow, give them as whatever fluid you have, provided it doesn't have sugar or anything. If it's ORS that you've made for yourself from home, that is the first line of treatment you can give from home. Fluids, rehydration. Replace the fluids, replace the salt, and replace the electrolytes if you can. If you have ORS that you've bought from the shop, that also helps. If you've made your own ORS, that also helps. If you don't have it, even just ordinary water, let them drink it. Okay? Let them drink it. That helps. So that's your first line from home. That is. When you get to the hospital, treatment will depend, first of all, on the state in which the patient has arrived. If the patient has arrived and they have what we call severe dehydration, the first thing that the health workers will do is to secure an IV line. They have to put a drip immediately. Because if someone has severe dehydration and they fail to put a drip, survival chances are very, very slim. So that's why I find that parents sometimes become very agitated. You go to the hospital, doctors are pricking your baby all over the place because they can't put a cannula. The reason they are failing to put a cannula sometimes is because the veins have collapsed. And when veins collapse, it's very difficult to find them, especially in children. That's why I find that in some cases, doctors will say, we failed to find the veins on the hands of your child. We're going to shave the head. Okay? Because sometimes veins are easier to locate in the head. So I'm sure some of you parents have noticed that, where your child was very dehydrated because of diarrhea and vomiting, and they couldn't find the veins in the hands or the legs or anywhere. They shaved the head, and they were looking for a vein in the head. Okay? Sometimes health workers do that. In extreme cases, where veins are not found in the hands, veins have not been found in the head, veins have not been found in the leg, they sometimes have put a drip in the bone, especially the bone of the leg. Now, that is in extreme cases where we push a needle in the bone of the baby and we run the drip through the bone. Now, that is extreme, okay? That only happens in exceptional circumstances and under very extenuating circumstances. It doesn't happen every day, especially one where you where you put the drip in the bone. Okay? Now, here's Wupe Mwila. Question. Doc, my child is teething, but yesterday she had diarrhea, which was red in color, and she's 7 months. Okay. Now, was that blood? And the other question you need to ask yourself is, how many motions, how many loose motions did your child have? Was it just one? Is your child still able to breastfeed and she's tolerating feeds normally? What you want to do, what I'm going to advise you for now, is that if your child is tolerating feeds, continue to breastfeed, or if it's a bottle that you're giving, continue to give that. If the child is still breastfeeding, continue breastfeeding. In fact, when your child has diarrhea, you have to breastfeed more often. Now, here's what you need to look out for, madam. Because this is just the first motion that your child has had, and you are saying the stool was red. My concern is that, why is the stool red? If you are really sure that the stool was red, in my mind, that means there's blood. And if there's blood in stool, don't hesitate. Take the child to the hospital. Even now, so you can get off social media and take the child to the hospital. Let them go and verify that that is not blood. Next question. Wilson Welu Ngoma, help me. What should I do with my paining shoulders and knees? They are paining too much, doc. My brother, that sounds like you may have arthritis or osteoarthritis, as the case may be. So in your case, what I would suggest is that, one of my lights has gone off. In your case, what I would suggest is that you need to go and see your doctor. Let them do x-rays, okay? Let them do x-rays on you and see if, and also do some blood tests to make sure that what you have is not osteoarthritis. Next question is, then Chipo Mood. I can't read your other name, Chipo. So you are saying even in Sesheke there is an increase in diarrhea. Sesheke, okay, I see. So this is just for our information. He's also agreeing that it's not just in Lusaka where we are seeing an increase in diarrhea cases. Even in Sesheke, it's the same situation. How's the situation where you are, guys? Please tell us. This is still Chipo's question. Chipo, you repeated your question, right? Paul Mshanga. Doc, sometimes I feel pain on my left shoulder. Okay. Today we are biased towards questions on diarrhea. Next question. Chipo, you really repeated your question. It's everywhere. Let's see. Is this a question? This is Juju Banda. The way they come to the clinic or hospital, Kuli Doc Mjajati said this at follow him ku. Okay. So, so people come to the clinic and they say, Dr. Mjajati said this. Don't do that to health workers. You're going to upset them. When you hear something on what that we teach you here and you go to the hospital, be careful how you bring up the issue. Don't tell health workers that I am here to do this because Dr. Mjajati said we should do it. When you go to the hospital, go and present your problem. Once you've presented your problem, allow the health worker, whether it's a clinic officer, whether it's a licentiate, whether it's a nurse, whoever, or it's a doctor, allow them to process your condition. When they have finished, then you start asking them questions. How about this? How about the other? Don't go to the hospital and tell a health worker that Dr. Mjajat said this, so I've come so that you can do it. That's very disrespectful. Don't do that to people. Okay? Okay, next question. Next question. Good. This is an interesting one. This is Lily Chibomba. Doc, please comment on lactose intolerance associated with diarrhea. Yes. Now, lactose intolerance is one of those diarrheal diseases that are not associated with an infection. And lactose intolerance is very common in Black people. This is a situation where when you take milk or milk-related products, that or any product at all that contains a specific type of sugar called lactose, you'll find that because your body is failing to digest it properly, it remains in your intestines. This is one of the diarrheas which is called an osmotic type of diarrhea. It remains in your intestines, and because it remains in your intestines and it's got a very high osmotic potential, osmotic pressure, it begins to attract water into the intestines. And because it is attracting water into the intestines, that's how you end up passing loose too. It's called osmotic diarrhea. And for some people, mainly us Black people, we are not able to process lactose. And any product that contains lactose, when you take it, it will potentiate that same problem, and that's how you end up with these diarrheal diseases that you have. The way you treat lactose intolerance is that, first of all, you need to recognize that you have this problem. After you recognize that you have this problem of lactose intolerance, every time you eat or you drink milk or you eat anything that has milk in it or that has lactose, you have diarrhea. The first line of defense for you is to avoid this type of food or this type of beverages that give you the lactose intolerance. So the first line of defense is avoidance. Stop taking things that give you this. Okay. Next question. Tazaso Bota. What about the type of diarrhea where one has an urge for the toilet, yet you find that when he goes but fails to defecate? What's the reason behind that? Now, that's not diarrhea. With diarrhea, you will pass loose stool. Except that I know what you're referring to. Sometimes you'll find that you've passed so much loose stool, and yet you feel the pressure, but nothing is coming out. Yeah, that can happen as well. But usually, in most cases, you should be able to pass stool. Okay. Chipo, you're everywhere, man. Chipo, could you please stop posting this issue that you're posting about Sesheke? We've already seen it. We want to be able to see other questions. Okay, here, there's a contribution here from Luisa Chiduka. Luisa Chiduka is responding to a request from Sarah. I think Luisa should be either a nurse or something. And she's suggesting, and she's giving the formula for how you can make ORS at home. She says you take 1 liter of water, and to 1 liter of water, you add 6 teaspoons of sugar and 1/2 teaspoon of salt. That gives you ORS at home. So, Chiduka, thank you for sharing this. I'm most grateful to you. I am very happy that you've shared this as well. So, Sarah, I hope you've seen this. To 1 liter of water, add 6 teaspoons of sugar and 1/2 teaspoon of salt. Shake nicely, and it should be warm water, by the way, I think, when you're making it. And shake nicely, that will give you your ORS. Thanks, Chiduka, for sharing this. And Sarah, I hope you have seen it. But like we said, we'll still get you the WHO standard and we'll put it on the page. You can also keep it once we post it. Okay. Edna Mlenga Mumba, Doc, how can one treat the sore that develops on a baby's anus after having severe diarrhea? In Bemba, it's called Ilonda. I've never seen that. What you are referring to, sometimes, it's not even a sore per se. I think what you are referring to is called intestinal prolapse. Sometimes when, even in an adult, especially the elderly, this can happen, where if they've had severe diarrhea, okay, if they've had several bouts of diarrhea and they keep going to the toilet, because of bearing down, intestines can actually easily protrude through the anal area. And this just doesn't happen in children alone. It also happens in adults, especially in the elderly. Okay. What can you eat to stop diarrhea? Now, Tendai Mutapure. Tendai, one thing we need to be very clear about is that diarrhea is both a problem and a solution. It's quite a paradox. Diarrhea is, in some cases, usually in most cases, it is your body's way of trying to get rid of a problem. Except that your body sometimes doesn't know when to stop. Your body sometimes doesn't know when it has done enough. And as a result, it's not able to tell that, okay, now I've managed to flush out everything, the diarrhea should stop. That is why some people will argue that when someone has diarrhea, don't give them anything to stop the diarrhea, because they are then locking the problem inside. So you allow the loose stool to happen. All you have to do is replace what the person is losing. There's also that theory that you don't give anything to stop the diarrhea, because if you stop the diarrhea, you are locking things inside that are not supposed to be locked inside. So that is why we insist that if you are having someone who has diarrhea at home, take them to the hospital. Okay, why? Because Health workers know how to deal with these issues. And also, don't be in a hurry to give people antibiotics from home. Especially, I've seen people will quickly prescribe things like Flagyl. Flagyl suffers in this country. If there's an antibiotic that suffers, is Flagyl. Everyone who has diarrhea is most likely on Flagyl. Okay? Don't do that. Take the patient to the hospital. Because diarrhea is both a friendly force and a bad force, but you have to understand it. It also helps to remove the poisons, but at the same time, if it overstays or if it is prolonged, it can also create problems. So that's why we need to take care of it that way. Lamech Vicloid. Okay. I hope I'm reading your name correctly, my brother. What causes my heart to vibrate when sleeping, Doc? What you're describing as vibrations is what we call heart palpitations. And heart palpitations at rest, especially when you are sleeping, it's a very serious sign that you may actually have a very serious heart disease. In your situation, it's very important that tomorrow morning itself, go and see your doctor. It's important that your doctor does certain tests that include an ECG and even an echo. An echo is basically an ultrasound of your heart. Okay, based on your profile picture, you seem like a very young person. You shouldn't be having such problems. There are certain things that I'm thinking about already that you could have in your heart that need to be sorted out. So, tomorrow itself, go and see a doctor near you. Let them assist you. All right? This is KZ. KZ, the question from KZ is it possible to suffer from typhoid without passing loose stool? Yes. That's why some people are carriers. And that's why typhoid continues to persist. And that is why in food safety, especially if you look at your local authority, if you have your council nearby, that is why they go around in these eating places to test people. It's extremely important because it's very possible for somebody to have typhoid and not even know that they have it. And they are busy passing it on to other people. That's very possible, actually. So to answer your question, the simple answer to your question is yes, it's very possible. It's extremely possible. Okay. Well, you have another question. Okay. Doc, if one has been diagnosed with typhoid but is not passing loose stool, and even during medication after diagnosis, no loose stool has been experienced, should that be a concern? No, it shouldn't be. What needs to happen is that if the person has been completely treated and cleared of the bacteria, because you see, they can take these two samples to the lab and either culture the samples or do microscopy, whatever the case may be. There's also a blood test that can be done to check. Okay. So once they find that you are a carrier for this, they'll put you on treatment to eradicate the bacteria. Okay. And once it's eradicated, that's it. You're fine. You're fine. You won't be a danger to the next person. There's an interesting question here. This is an end-time believer, Baraka. Okay, Doc, what type of diarrhea is more dangerous between the one with blood and one without blood? Now, your question is very difficult to pick either one, and I'll explain why. If you take cholera, for example, cholera does not present with blood in stool. And yet it's extremely dangerous. And you've seen it kill people. Dysentery and typhoid present with blood in stool. They are both very dangerous if treatment is delayed. So to answer your question, you cannot, it's very difficult to say that diarrhea which has no blood is less dangerous than diarrhea which has blood, because either way I can give you examples of diarrhea that is very dangerous. In children, for example, okay, you have diarrheas that are caused by viruses that start with vomiting. A child starts with vomiting, and then they start having diarrhea. The diarrhea you will find doesn't always come with blood. It doesn't come with blood at all sometimes. And so there's no blood in stool, but the child will suffer very serious form of diarrhea, and it's a viral infection. And in most cases, if it's not properly handled, children have died. So to answer your question, you cannot say that diarrhea which has no blood is better than diarrhea which has blood. What you need to bear in mind is that if you are nursing a child or yourself or somebody in your home and they've had bouts of diarrhea, at least 3 or more bouts of diarrhea, okay, over a short space of time or in 24 hours, such a person needs to go to the hospital, whether there's blood or no blood. However, if there's blood in stool, even one bout of diarrhea, because there's blood in stool, you need to take that person to the hospital. So if I was asked to choose one, which one of the two is more dangerous, I would say both, depending on what is causing it. That's how I would answer the question. Okay. Zindara Jane Banda. Doc, how best can one help stop the vomiting? Our babies are doing both, diarrhea and vomiting. They can't hold down any food. That's a baby who is a candidate for an IV line. You have to go and put an IV line. That's a candidate for a drip. They have to go to the hospital and put a drip, okay, until the infection passes. Usually in such situations, you find that it's actually a virus, okay? What you're describing sounds like a viral infection. Rotavirus, that's what you're describing. Sounds like a rotavirus infection. So let them go and put in the child, let them go and give the child a drip until that child is able to tolerate feeds. And I hope this child is not at home. Okay? I hope this child is not at home. I hope this child is already in a hospital setting. Next question. Okay. So this is Kelly Chongo. Lip dryness is a sign of one being dehydrated. Correct. Now, another sign you can tell, and mothers, I need you to pay attention to this one. Parents, please pay attention to what we're going to discuss now. How would you know that your baby is dehydrated? How would you know? And that this dehydration is very dangerous, that you actually need to rush to the hospital. Here, I need all parents and soon-to-be parents to really pay attention. Number one, if your child is crying and there are no tears, that's serious dehydration. Okay? Your child is crying, there are no tears. The mouth is dry. And your child has a weak cry, weak, tired cry. You know that the child is dehydrated. The other way you can tell if your child is dehydrated is that if you pinch the skin, and the skin, you pinch the skin like this. I don't know if you can see this. You pinch the skin like this, and it pulls, and it goes down slowly, especially if you pinch the skin around the belly. You pull the skin around the belly, and the skin is going down slowly. You know that your child is very dehydrated. All right. Now, when dehydration is not addressed, In the worst form, your child will lose consciousness. They will become very weak, extremely weak, and you can't even arouse them. They become unarousable. When dehydration reaches those stages, you are late. So if your child has been having diarrhea and vomiting, and you see the child starts to cry, and your baby is not producing tears, okay, and they are not tears, you know your baby is very dehydrated. Rush to the hospital. Start running. If you have ORS nearby and your baby can tolerate feeds and can drink, make them drink. As you are rushing to the hospital. That's a bad sign. Those are danger signs that parents need to pay attention to. So if you are a parent and you are here, let me repeat myself. Your child has been having diarrhea and vomiting, and you see your child is crying and there are no tears, or your child has a very weak cry, okay, and you check the diaper, there is no urine, this is a very dehydrated child. You pull the skin and it's going back very slowly. In a child who has diarrhea, madam, sir, rush to the hospital. Those are danger signs. Those are, if you delay a child like this one, it's a danger sign. Serious danger sign. And someone has just reminded me, and the child's eyes are sunken, like in here. Means you are eyes are sunken. Those are danger signs. In fact, sunken eyes is a danger sign, very dangerous sign, very dangerous. Rush the child to the hospital. Rush the child to the hospital. Okay? All right? Mwamba. So thanks for joining us today. And thank you for being so interactive. So what you're going to do is, ladies and gentlemen, share this video. It's very important that you share this video because we need as many people as possible out there to get this information. Diarrhea cases have increased. You don't know how many people you may save with this information. So please share this video. We are about to get into the rainy season. Okay, you have so many flies around because of the weather. Flies are now, giving birth. Flies are pregnant during the hot season like this. All the flies are pregnant. They are busy giving birth and they are multiplying. So bear that in mind as well. So share this video. We need this information out there. You don't know who you might save. It's very important that you do that. Okay. And above all, we would like to thank our sponsors, MTN through IO, for making this conversation possible. Diarrhea is a very, very serious situation in Zambia right now in various communities. So please bear in mind. All right. So as we end this program, here is a message from our sponsors.
IO is easy, and to sign up is just as easy. Meet Abel Mutula from the barbershop in Kalingalinga. Abel Mutula is also an IO customer.
My name is Abel Mutula. Signing up with IO was easy. This is how I signed up. Step 1, dial *296#. Step 2, select 1, sign up. Step 3, select either 1 for my hospital or 2 for my life. Step 4, fill in your age and confirm. Step 5, select 1 to accept the IO terms and conditions. Well done, you signed up. Now let's add my loved one.
IO together with MTN. IO, because you care. What can you do? What can you do with 5 kwacha? Not a lot. A 5 kwacha auto boost can get you 1,900 kwacha extra IO cover. Bernard Mulindu auto boosted, and Bernard received a total payout of 2,070 kwacha when he needed it most. Here is Bernard's story.
My name is Bernard Mulindu. I'm Punkena Moto. Kairi ko hospital check. It's a pipe on a problem. 296 hash. Ngasanya kwa chat. Wametumira kwa 2 2 Kairi amanda kusongera tukara mukurazichi yakura tawole bomba. Alipira kwa nabana ku masku. Bali bomben tuisuma sana.
Dial star 296 hash to auto boost and quickly grow your IO recharge with care cover each time you recharge. IO together with MTN. IO, because you care.